If you are over 60 and doing lower back pain exercises to find relief, stop right now. Many of the most popular back pain exercises you see online were designed for younger, healthier spines. But after 60, your spine has changed. And what relieves back pain in a 30-year-old can cause serious damage in someone your age. In this video, I will show you exactly which exercises to stop, why they are making your pain worse, and what to do instead for real lower back pain relief. Why your spine after 60 is different. Here is what most people do not know. After the age of 60, 3 changes happen inside your spine that change everything. First, your discs lose water. They become thinner and less able to absorb shock. What used to cushion a movement now creates friction and pain. Second, your spinal canal, the tunnel that protects your spinal cord, begins to narrow. This is called spinal stenosis, and it affects millions of people over 60 who do not even know they have it. Third, the small joints in your spine, called facet joints, develop arthritis. They become stiff and inflamed. Let me explain why this matters. An exercise that stretches or compresses your spine in the wrong direction does not just cause temporary discomfort. It actively presses against already compressed nerves. It increases inflammation in already inflamed joints. The pain you feel the next morning is not soreness from a good workout. It is your body telling you something is wrong. The 3 exercises to stop. Now let's talk about the specific exercises you need to stop doing. Exercise number 1, toe touches and standing forward, bends. This is one of the most common lower back stretches recommended online. And for people over 60, it is one of the most damaging. When you bend forward and reach toward your toes, you place enormous compressive force on the front of your lumbar discs. For a younger spine, this is manageable. For a spine with thinning discs and narrowing joints, this pushes disc material backward, directly toward your spinal nerves. If you have ever done toe touches and felt a sharp shooting pain down your leg afterward, now you know why. Stop doing this exercise. Exercise number 2, full sit-ups and crunches. Sit-ups are taught as a core exercise, but research in physical therapy shows they are one of the highest compression movements a spine can experience. Every time you pull your torso upward in a full sit-up, your lumbar spine bends under significant load. For an aging spine with arthritic facet joints, this is not building strength. It is grinding inflamed joints against each other with every repetition. Many of my patients at Texas Back Relief come in after weeks of doing sit-ups for back pain, and their pain is significantly worse. The intention was right. The exercise was wrong. Exercise number 3, standing high knees and high impact movements. High knees, jumping jacks, running on pavement, these are often recommended as back-friendly cardio. But every impact your foot makes with the ground sends a force up through your ankle, your knee, your hip, and directly into your lumbar spine. For a spine with compressed discs that can no longer absorb shock properly, this repetitive impact accelerates degeneration. It does not help it, but now you know what not to do. So let's talk about what actually works. What to do instead. 3 replacement exercises. The good news is that there are safe, simple back pain relief exercises designed specifically for the aging spine. Exercise number 1, seated knee to chest. Sit upright in a sturdy chair with both feet flat on the floor. Slowly bring one knee up toward your chest. Hold it gently with both hands. Hold for 10 seconds. Then lower it slowly and repeat on the other side. Do 5 repetitions per side. Why does this work? Unlike a standing toe touch, this movement gently opens the back of the spinal canal, exactly where stenosis causes compression. It creates space, not pressure. It reduces nerve pinching without loading your discs. If you feel better, or at least not worse, during this exercise, that is your signal that your spine responds well to gentle flexion. Exercise number 2, lying pelvic tilts. Lie on your back with your knees bent and your feet flat on the floor. Gently press the small of your back down into the floor, like you are trying to flatten it. Hold for 5 seconds. Then relax. Repeat 10 times. This is one of the safest back pain exercises in physical therapy for people over 60. It gently activates the deep core muscles that support your lumbar spine, without any compression, bending, or twisting. Most people feel immediate relief after the first set. Exercise number 3, supported walking with a slight forward lean. Walking is excellent for back pain, but only when done correctly. For people with spinal stenosis or lumbar arthritis, walking upright with a perfectly straight posture actually narrows the spinal canal further. Instead, walk with a very slight forward lean, as if you are leaning into a gentle wind. This gentle flexion position opens the spinal canal and reduces nerve pressure with every step. Walk for 10 to 15 minutes at a comfortable pace. Use a shopping cart, a walking stick, or a wall for support if needed. Do not push through sharp pain. If you have learned something new today, or feel like this is guiding you in the right direction with your back pain, subscribing will not cost you anything, and it helps us reach more people who are suffering and need this information. Before I go, one rule I give every patient at our clinic. The rule is simple: feel better, or at least not worse. If any exercise in this video increases your pain, sharpens it, or sends pain down your leg, stop immediately. Every spine is different. What works for most people may need to be modified for you. The only way to know for certain what your spine needs is a proper evaluation. Remember, you do not have to live with lower back pain forever. Relief is possible, and help is here for you. If you are in Texas and ready to find out exactly what is causing your back pain, call us today for a free second opinion. Our clinic is in Lancaster, Texas, and we serve patients across the entire state. Watch this next video to learn the strengthening exercises that protect your spine long term. I will see you there.